And now for the moment we've all been waiting for. I don't want to say too much about this year's honoree even at the last minute, because the big reveal of the 2019 Magnet Prize winner is a secret so closely guarded that not even the winning organization's nursing staff knows they won. I will tell you that the winning program is in the Magnet Model category of structural empowerment, and that this program has the potential to transform care delivery through its innovative approach to reducing food insecurity and improving health for those living in the most impoverished areas in the community. Ladies and gentlemen, it gives us great pleasure to announce the winner of the 2019 ANCC Magnet Prize, sponsored by Cerner. For their program entitled A Comprehensive Community Approach to Reducing Food Insecurity and Improving Health, one zip code at a time, from OSF Healthcare, St. Francis Medical Center, Peoria, Illinois. Dr. Jennifer Hopwood, Dr. Joe Garrison, and Susie Smith. You're simply the best. Better than all the rest. Better than anyone. Thank you very much. I have to tell you, that was a really tough secret for us to keep from our team. I'm Jennifer Hopwood, and on behalf of OSF Healthcare, St. Francis Medical Center, and my colleagues, Joe Garrison and Susie Smith, we are honored to accept this prestigious award. We would like to thank both Cerner and ANCC for this incredible recognition. The lack of money to purchase food is a reality for 40 million Americans, and it was a recognized problem for 2 zip codes in our community whose average household incomes fell well below the poverty level. We know that inadequate nutritional intake contributes to or worsens existing health problems and can have a long-lasting impact on one's health. At OSF St. Francis, we knew we needed to connect with these people from these areas in a very different way, as we were seeing a high volume of emergency department visits for non-emergent reasons from those zip codes. Nurses at OSF St. Francis have created a 6-part, comprehensive, evidence-based program far removed from the traditional bricks and mortar of a hospital, which is improving the social determinants of health in these areas. We've combined faith community nursing, a mobile free clinic, community gardening, assessment of food insecurity, and the education of both nurses and children to meet patient needs directly where they live and transform the health of their neighborhoods and in turn, our community overall.
The faith community nurses partnered with more than 35 churches to be an advocate, liaison, and resource for residents while focusing on the intentional care of the Spirit. The affiliation with local faith-based organizations was important because our prior efforts to engage this population had been unsuccessful. Residents were seeking out their churches for assistance, which allowed our nurses to perform needs assessments, provide education, advanced care planning, and one-on-one consultations to individuals. This allowed us to bridge the gap between their community and our health system by building trusting relationships. Our nurses provide free care at local community agencies and churches in our caravan, Our caravan is a 40-foot mobile medical clinic outfitted with clinic rooms. Providers, including dentists, financial counselors, and other care team members, help staff this mobile clinic up to 3 times a week at different drop-in sites. Partnerships with University of Illinois College of Medicine and other local colleges have helped to expand the number of clinics in recent years. Our caravan clinics led us to discover the prevalence of food insecurity in these areas by using the USDA's 2-question hunger vital sign. 85% of individuals reported, despite having governmental assistance for food, there was a time in the last year their food ran out and they were unable to buy more. We also found our nurses had limited knowledge on how to assess for food insecurity. So education was developed to teach about the hunger sign and prevalence on our community and the impact in its overall health. We realized the opportunity with our community gardening after one of our faith community nurses planted a garden at her church. OSF St. Francis hired a gardener, and through partnerships with the City of Peoria, the Peoria Park District, local schools, and other community agencies, over 2 acres of city lots have been transformed into gardens, and produce is being distributed directly to residents and to local community agencies. Volunteers from OSF, local colleges, schools, and churches donate their time to tend to the garden. Our employees, who we call mission partners, have also taken an active role in fundraising for this initiative. And lastly, children living in these zip codes are provided an educational program teaching gardening skills, health and wellness, stress management techniques to encourage healthy behaviors.
As a result of our program, we are feeding people in need, removing obstacles to care, promoting healthy behavior change, and heightening our awareness as nurses of food insecurity and its impact on overall health. Our efforts have yielded 1,900 fewer emergency department visits for those living in the affected zip codes. Future plans include building a greenhouse and a pavilion to further support our current endeavors, developing the ability for our nurses to distribute a meal when they encounter a person who is food insecure, and the inclusion of assessing social determinants of health in our electronic medical record. OSF St. Francis nurses are continuing the work to transform the health and improve the lives of the people that we are serving. We're honored to have ANCC and Cerner recognize the work that OSF St. Francis is doing to improve food insecurity in our community, and we look forward to returning next year to share with you our progress on this work. Again, thank you very much.